pain in the hip or down towards the knee, don't forget about the TFL. Today I'm going to show you some techniques to release it gently and effectively. My name is Beth, and I am the founder of Cantado Wellness Education Center, and it's Technique Tuesday. So let's dive into the TFL. Have you ever had a client who complains about pain in the IT band, in the knee, or in the anterior hip? Um, it's often the TFL, and it's an overlooked muscle that we don't always pay attention to. Um, it comes from the ASIS, right? Which is that anterior hip bone. A lot of people call it the hip bone. They also call it the pocket muscle because it sits right here where our pocket in our jeans is. So this muscle goes from the ASIS down and inserts into the IT band. So if we've got people with knee pain or a lot of pulling in the IT band, the TFL is a muscle that we probably should address in our sessions. It's kind of a relatively chunky muscle. A lot of people think it's small, but you can really get a hold of it here on the anterior thigh, up into the hip just a little bit. You want to make sure that your client's got a bolster under their leg and that their knee is slightly bent as you work into it. It is a hip flexor and a rotator medially. So we're going to kind of just reach in here and get a hold of this chunky muscle here on the front. Now, if you want to be sure that you've got a hold of it, we're going to just have them bring their leg up and their knee in just a little bit. And as we work this, we're going to kind of grab a hold of it, and we're either going to move our client's knee kind of back and forth, or we can ask them to kind of move their knee in and out on their own. And we've got a hold of this TFL right here. Okay. So if you wanted to really stretch it out, what you could do is have your client scooch to the edge of the table, and then we're going to just drop that leg down off the table, and then we've got it in a stretched position, and we can do a little bit more elongation here. So I'm moving from the IT band back up to the ASIS with this technique, and we're just lengthening out that TFL tissue. Now, let me know in the comments if the TFL is a muscle that you already work on most of your clients with hip or knee pain. And I will talk to you next Tuesday. Have a great week.